try to pair them with our topic for the day. So I'm going to start with the first audience question. And Dr. Loretta, I'm going to throw it to you first. I'm
Okay.
a high performer who is missing small details, minimally engaged during meetings, and they seem to be slightly less energetic, perhaps approaching or perhaps are already burnt out. Yet, every time I ask, they insist they're fine and they don't want to slow down. What should I do?
Mm. Wow, that's a good question. Always appreciate those audience questions. But for me, the first thing I would want to do is like have a private conversation with them, maybe let them know that I've seen some changes in their behavior, like the lack of energy, as you said, or minimally being engaged, and especially if they were really engaged a lot before. So I would want to have that private conversation. And I know you said you're fine, but if there's offer, if there's anything I can help with, or if there's a workload or something, maybe they need a reduction in it. And always let them know that my door is open to talk to them. And if necessary, if they need to go to HR, maybe they want to have a conversation, a private one, if there's an EAP or something in the organization, but just let them know there are resources in case they are dealing with something or just burnt out.
Great. Thank you, Dr. Loretta. And how about yourself, Dr. Dre?
I would almost say ditto to what Dr. Loretta said. So I think the high performer who says they're fine probably isn't fine, right? And so I think for the supervisor, I think giving them their space while being respectful and acknowledging who they are in terms of a high achiever. And so I think name what you see. Don't try to diagnose. You're not here to diagnose. Just name it. What are you seeing? I noticed that you seem to be a little bit disengaged or things have been slipping in terms of details. And then making sure you separate, always want to separate the person from the performance, right? High performers will often equate slowing down with failing. So make clear
Mm.
that this isn't a performance conversation, right? And then give them an off ramp. I think that's Dr. Loretta said. Give them a bit of an off ramp instead of saying take some time off. If there's something you could take off your plate, what would it be? So you again respect their space as well. And so making sure you just respect that because high achievers will sense if you're trying to take things away or if you're trying to change the flow. And they take it personally. And so you want to make sure you respect that high performer because maybe they might be going through some things and you want to respect that as well. So.
Right. Thank you, Dr. Dre. How about yourself, Jacqueline? Anything you might add?
No, I think that they've covered it well, very well.
Mm,
Excellent.
great. Wonderful. So as we dive into managing stress in the workplace, what can leaders do to stay fortified themselves and protect their teams? Um, uh, I'll ask you, Jacqueline, our fabulous guest for today, to maybe share a little bit about yourself and your connection to this topic.
Mhm. Well, thank you for having me, first of all. And I would say that I've spent years in management and coaching and providing therapy services to individuals, couples, and families. And I've learned actually the hard way with working with employees. I had one employee tell me that when I was stressed, which I didn't even recognize I was stressed, everyone feels it.
Mhm.
And that was a eye opener for me because I didn't even recognize, like I said, that their stress was there. And I was felt like I was just doing what I needed to do to get things done. And so sometimes when I know we model the behavior, and for me to have an employee tell me that was really eye-opening. And then I went on the journey of trying to figure out what tools do I need to use that I'm familiar with and giving other people, but I'm not using them for myself.
Wonderful. Thank you so much. Well, we're pleased to have you here. And I'll say I'm double pleased to have you here because Jacqueline is my sister. So I've
Wow.
had a up close, one might say, observation of your journey, and certainly you've helped me with mine. So again, welcome.
Thank you.
Dr. Dre, I'll toss it over to you.
Right. I'm waiting to get to the part where we can ask Jacqueline some questions about Dr. Cheryl. get the real stress going on here. That's what I'm talking about. I want to jump to that part, but we'll wait. So, uh, so let's talk a little bit about differentiating the stress, right? Stress that leaders may go through versus maybe what their team might go through. And I guess my question to you, Jacqueline, is we talk about some of the basics like leadership pressure. What makes leadership stress different from perhaps the stress that most employees may experience? Is there a difference?
I think that leaders often carry I believe, unintentional
Mm,
stress, as I just talked about, even for myself, and then also intentional in the sense of having to have the decision stress that's carried. And by that, they're in a state of cognitive fatigue or emotional strain that can really occur when we're facing complex or high stakes choices or under tight deadlines. And it can appear uh, for others around them
mm,
that we're being impulsive or this is habitual, or even we receive from our staff maybe
mm,
avoidant behaviors. And so the choices that affect us are often like budgets, timelines, people, and outcomes that creates a unique pressure for both emotional and operational needs. And the leaders don't manage that pressure well, it can stay contained, or if it's not managed well, it can spread.
mm, mm. Wow, that's great. And I think sometimes, I don't know, if leaders are supposed to make those who are on their team feel the pressure too. That's something we can get into a bit later. But I know there's been one side that says, well, if the leader feels the pressure, leader's pressure and stress should be shared with the rest of the team as well. And I'm not sure how
Right.
healthy or unhealthy that might be as well. So, because sometimes it
Right.
does bleed into that.
I'm gonna flag it as unhealthy.
You think so? Okay. All
I
right.
don't, I mean,
It's
we can weigh in
interesting. It
now.
is unhealthy. One of the things that's interesting, even today, I had a client earlier who's a professional in the healthcare system, and she's coming with a lot of anxiety. And she said, "Oh, I think I've normalized this for so
Mm,
long because
mm,
for women,
Mhm.
we see it as a high sense of urgency to respond."
mm,
And I thought that was huge because she recognized it. She just got her doctorate,
Mhm.
and that high performance has been what's driven her. But yet now she's looking at it and she's wanting to have a child, and she feels that anxiety all in
mhm.
her body.
Yeah. Thank
That
you.
that whole notion of chronic stress, where
Mhm.
it just becomes normalized, is definitely
Right,
something
right.
to think about. You want to say anything else about chronic stress, Jacqueline?
No, I think that we will touch on that.
Okay.
Or we did we
Mhm.
not? I think we touched on it, so I'll wait.
Okay. Awesome.